Hello, welcome to my frequently asked questions. Today we're talking about laser resurfacing. What can laser resurfacing be used for and how can it benefit you? My name is Dr. Julian De Silva and I'm a London-based facial, cosmetic and plastic surgeon, and I specialise only in the face and have been using lasers in some form or another for over 10 years. So today we're going to be talking about what can laser resurfacing be used for. We'll also talk about when lasers should be best avoided, and then we'll talk about, well, what can give you the best possible result when considering having any form of laser resurfacing. So first of all, what are the benefits or potential uses of laser resurfacing? Well, laser resurfacing has the potential to rejuvenate the quality of your skin. So it can treat fine lines, wrinkles, it can treat pigmentation and sunspots that is often secondary to sun damage. It can treat fine scars in the skin, such as from acne scarring. It can also be used to reduce the size of pores, and for some patients, particularly fine lines around the eyes and around the lips, well, it can be effective in reducing these and improving the quality of your skin. And certainly it was a big innovation when laser resurfacing first came about, because before that time we really didn't have technology in order to improve this. So in terms of the patients we should be more cautious about, well, if you have a darker pigmentation or more ethnic skin, well, laser resurfacing needs to be more cautiously done, and for some patients, particularly with darker pigmentation, it may not be suitable to have laser resurfacing. And certainly I would advocate being more cautious in such patients and generally doing a skin patch test before doing laser resurfacing. Well, this is a very safe way of identifying patients who may have a very prolonged recovery from laser, and laser resurfacing is the best avoided in. If you have known types of scarring and scar conditions such as keloid scarring or other relatively rare dermatological conditions, well, it's important to let your physician or surgeon know so that they can take that into account, and it may be some situations that, again, a test patch is best advocated, or in some patients it may be best avoided altogether. Also, if you've been taking any recent medications such as Accutane for acne, well, this can affect the healing of the skin, and so it would be important to wait a period of months after stopping Accutane to make sure it's safe in order to have laser resurfacing. Moving on from that, well, expectations are also important when considering laser resurfacing, because if you also have additional aging and loose skin and generally some effects of gravity, well, laser resurfacing will improve the quality of the skin, but it won't lift the face, and sometimes it may be useful to combine laser resurfacing with non-surgical or surgical techniques to give you the best possible result. So the final thing we were going to talk about is how can I ensure that I get the best possible laser resurfacing? Well, it's important to consider both the potential benefits and advantages. It's certainly important to consider the potential indications that are best avoided, and also it's worth considering what you are looking to achieve, and this may be a combination of combining laser resurfacing with non-surgical or surgical techniques. My preference is to use a state-of-the-art modern laser that has CO2 resurfacing that will tighten the deeper skin, Erbium laser that will tighten the superficial skin, and this state-of-the-art technology means that you're giving the maximum potential benefit from tightening the skin. In addition, I personally use biotechnology, the use of platelet-rich plasma, which means using your own growth factors to heal the area that has been treated from the laser faster. Essentially, this means taking a little bit of your own blood. That blood is put into a machine that will spin and then double spin your blood in order to concentrate your own growth factors, and then these growth factors are put into the areas where the skin has been lasered after laser resurfacing. And what this does is it enhances the recovery from laser resurfacing. So in summary, we've talked about the potential benefits of laser resurfacing, we've talked about the potential downsides, and we've also talked about how you can get the best possible result. I hope this information has been useful for you. Thank you for watching.